Insights from the world's best medical minds. You are watching TheRightDoctors.com.
Hello everyone, I am Dr. Rajesh Upadhyay. I am Senior Director and Head of Gastroenterology at Max Super Speciality Hospital, Delhi. And you are listening to me on TheRightDoctors.com, which is India's leading medical knowledge platform. Now I'm going to talk about the COVID-19 and gastrointestinal and liver effects. The COVID-19 has struck the world, involving more than 212 countries with more than 80 million cases and the death of about 500,000 or more people worldwide. And that's a huge epidemic we are dealing with at the moment. And therefore, it is very important to talk these days about how to manage ourselves and how to manage our patients in these difficult times. Now, although it is very well known that COVID-19 is predominantly a respiratory infection causing fever, cough, and dyspnea with other features, but I must say that the gastrointestinal and the liver effects have not received its due importance, which it should have. And recently, the Journal of the Indian Medical Association had a big article on COVID-19 with very little on the gastrointestinal and liver effects, and I wrote to them, and they have published it in the May issue about the GI and the liver effects of COVID-19. So, such a huge pandemic we are dealing with, we need to know about the GI effects, and it has been seen and reported from various parts of the world that almost 30 to 50% of the patients with COVID-19 have gastrointestinal manifestations such as anorexia, nausea, vomiting, diarrhea, etc. And out of all these, clearly nausea and vomiting is very common, but almost 1/3 of the patients who present with gastrointestinal symptoms have diarrhea as the main feature. So diarrhea is common, and sometimes it has been seen that diarrhea is the only manifestation and the initial manifestation, even in patients who do not have any respiratory symptoms or any fever. And there was a big report from Wuhan, which is the epicenter of this pandemic, that they looked at retrospectively on a large number of hospitalized patients and found that about 22 to 23% of the patients had GI symptoms only. More than 50% had respiratory symptoms, and the rest had both a combination of respiratory as well as GI symptoms. So if you have a patient with diarrhea and a history of contact with COVID-19 patient, then I think we must have a lower threshold for suspicion of this infection, and we should do appropriate testing for them. In addition to this, it has certain implications, because question is there a fecal oral transmission of this condition? And there has been reports from various parts of the world that almost 50% of the hospitalized patients have fecal shedding of the virus. So they tested the fecal RNA, and that was found to be positive for the virus, even in those patients who did not have the respiratory positivity for the RT-PCR. Therefore, fecal shedding is definitely there. It is slightly controversial as to whether it amounts to infection transmission or just a fecal shedding. But I think we must accept that the ACE2 inhibitors, for which the virus has a great affinity, has been seen to be expressed in the gastrointestinal epithelium in addition to hepatocytes and the cholangiocytes. So clearly, they have a binding over there and they can produce symptoms, and patients with GI symptoms may have more severe disease and they may have longer shedding of the virus and may therefore require longer period of isolation. What is the practical implication? We are all talking about putting on a mask, having physical distancing, and washing our hands, which is maintaining a hand hygiene. But in addition to that, I would like to emphasize on a couple of things more. And that is that we should always close the lid or the cover of our toilet before flushing, because flushing causes an aerosol effect and can lead to infection. In addition to all the standard measures, remember to sanitize your toilet taps, door handles, toilet buttons, etc. So that is a very important area which has probably not been emphasized enough. In addition, I would like to point out another important point is that there are a large number of patients worldwide who are taking acid reducing drugs such as proton pump inhibitors. And it is the acid in the stomach which kills the viruses. So if you take the acid reducing drug, you are probably increasing the chances of viral infection, particularly COVID-19 in these times. Therefore, the use of acid reducing drugs should be minimized to wherever it is absolutely necessary. Now, in addition to producing the symptoms, there are a variety of gastrointestinal conditions where there may be a more severe disease or there may be more severe manifestations of COVID-19. And these are particularly patients who are immunosuppressed or those who are on steroids or immunomodulatory agents. And we have very commonly in our specialty patients with inflammatory bowel disease who are taking steroids and immunomodulatory agents and sometimes the biologics, the biosimilars, and therefore that is an area or that is a group of patients we have to be careful about. Now, it is very important that such patients remain in remission during this time. So, whatever they are taking, we encourage them to continue with that so that remission is maintained. Because if they have an exacerbation, they are likely to be admitted in hospital, exposing them to further infection, and we may have to modify their drugs accordingly. So if they are on immunomodulatory drugs and if they have contracted COVID-19 infection, we need to probably stop the immunomodulatory agents and delay the start of the biologics such as the adalimumab, which we commonly use. Therefore, these are some of the guidelines which has come in view of this infection. Now, let me come to the liver problems associated with COVID infection. And it has been seen that more than 50% of the patients with COVID-19 infection have elevation of SGOT and SGPT to a mild or moderate extent. Severe rise, which is very high levels of enzymes, may denote severe COVID-19 infections. And in the last couple of weeks, I've seen patients who have teleconsulted with me with very simple symptoms like, Doctor, I have lost my appetite, I'm not feeling too well. And I said, get a liver function test. And they had moderate rise in SGOT, SGPT. We got the ultrasound done, we got the viral screen done, which is the standard one for A, B, C, and E. And they were all negative. And some of these patients, I must say, who did undergo COVID-19 testing were found to be positive. So, uh, rise in SGOT, SGPT may also be considered to be a manifestation of COVID-19 infection, and most of these patients may have mild disease and recover by themselves, and they may not have a lot of medications to be given. However, there has been reports of acute hepatitis, and this has come from the USA, a typical viral type of hepatitis occurring in a COVID-19 infection patient. And we have ourselves seen and have actually sent for publication at the moment a case of a middle-aged lady who presented only with nausea and vomiting and was found to have severely deranged liver function test and features of acute liver failure and she turned out to be a acute on a chronic liver failure with uh, acute renal failure or a hepatorenal syndrome, and she actually succumbed to the disease within 2 or 3 days of hospitalization, suggesting that this was a fulminant infection. We have sent this particular report for publication and awaiting response at the moment. So liver is certainly an organ which can be affected, not only affected, but can have severe manifestations. And particularly there are a certain group of patients, such as those with fatty liver. And patients with fatty liver usually have not only the fatty liver, but the associated features of metabolic syndrome, such as obesity, diabetes, uh, hypertension, etc., which are all comorbidities where COVID infection has serious consequences. And therefore, they are patients who have a high risk, and they must be managed properly during these times. In addition, patients with autoimmune disease, they're also another group of patients because they're taking steroids and immunomodulatory agents, and they have to be maintained very carefully during this time so that they do not have any exacerbation of disease. Now, patients with liver cirrhosis have got altered immunity. They are immune deficient and they are at a higher risk of contracting. And we have seen a number of patients who came in with decompensation of their liver disease and when investigated were found to have COVID-19 infection. So I think patients who have got cirrhosis become decompensated. Please consider COVID-19 infection as well, especially during this time. Another point I would like to put forward is the fact that particularly patients who, as part of the decompensation, develop ascites, and we do a diagnostic or a therapeutic tapping of such ascites, that there is a very high viral load in patients with ascites. So whoever is doing, especially our younger colleagues, the junior doctors, we must ensure that they are wearing the entire PPE kit before they are doing the procedure and they are taking all the precautions. So that is something which we have found out only recently, and we are taking all precautions in our practice currently. Another group of patients are those who have had liver transplant or are awaiting liver transplant. And as of now, most of our patients who are awaiting liver transplant, we are avoiding any transplant currently unless they have a very short lifespan. And those are the patients who are being subjected to transplant currently. So avoid transplantation currently because post-transplant they'll be receiving steroids and immunosuppressants, and they are clearly a high-risk patients. And if you're going for a transplant, you clearly need to check the COVID-19 status in such patients, but not only in the patients, but also in the donor, and then proceed ahead. So these are some of the liver and the gastrointestinal effects I've been talking about. There has been a huge number of papers from all over the world, especially China and America, and we have ourselves written a review article which is awaiting publication currently. Now, in view of all this, what have we learned? And I think it is very important to emphasize to everyone what we have really learned. And the most important thing is that, particularly for our liver cirrhosis patients, we make sure that they do not come to the hospital. We certainly encourage teleconsultation for them, advise whatever minimum test is required, which they can get done either as a home collection or from their nearest lab. And we take care of them because subjecting them to the hospital environment increases their risk of developing the infection. So teleconsultation is something which we have learned, and I think it is there to stay because we have got I think at least the next couple of months, if not more, to deal and live with this infection. Now, what else have we learned? Well, during the COVID times, we have limited our endoscopic procedures because, for example, endoscopy is a aerosol generating procedure, and we are clearly exposed to COVID-19 infection in such patients. And therefore, we use the entire precautions with the PPE kit, the mask, the face shield, and everything on before we do the procedure. And we also decide very carefully as to who really needs the procedure. And we are doing the procedure currently on patients who have got emergencies such as upper GI or lower GI bleeding, or those who have got complete dysphagia with a malignant obstruction or something, and patients with perforation, etc. So we try and judge and limit our procedures. And when we do the procedures, we take all the precautions in order to protect ourselves, use the minimal manpower, because that is also important. We have had a large number of healthcare workers within the hospital who are now affected with COVID-19 infection, and we have to make sure that the department keeps running, and we have to make sure that we use the minimum manpower for any infection. So limit the procedures to wherever it is necessary, otherwise we can certainly postpone it for a later date. Now, what else have we learned? I think the three most common problems for which I am getting teleconsultations these days are acid reflux, which is heartburn and the water brash, etc. Patients who have developed constipation during this period, and patients who've got bloating, abdominal bloating, which is very common. And these three, and all of them, are all lifestyle problems related to the lockdown, where people were stuck to their homes. The exercise became less, and probably the food intake also was not appropriate. So what do we do? Simple things for patients with GERD. What do we advise? Well, simple diet, avoid fried foods and fatty food, and take food which is at least 25% less than your appetite. Take it frequently, but not never fill your tummy up, and don't lie down in bed for about 2 hours after having your food. And in addition to that, we may require acid suppression drugs, which we give as and when required. Patients with constipation, again, a few lifestyle problems are very pertinent. They have to have plenty of fluids, particularly in summer, 3 to 5 liters of fluid, plenty of high fiber food, and plenty of exercise. And all these three go a long way. In addition, we require simple laxatives, which we prescribe as per the individual requirements. And lastly, patients with bloating, and particularly in North India these days, people take a lot of what we call the high FODMAP food. And high FODMAP is basically fermentable carbohydrates, which produce a lot of gas in the tummy and therefore causes bloating. So the first advice should be that you go in for a low FODMAP diet. Probably avoid milk, because a large percentage of Indians are lactase deficient, and if you're taking too much of milk, it can produce a lot of gas. Avoid foods like pulses and beans and peas, and there are vegetables such as cabbage and cauliflower and ladyfinger, and all these radish and all, they can produce a lot of gas. So alteration of the diet itself can provide a lot of relief. In addition, we provide sometimes the prokinetic drugs, simple medications which increase the gut movement and therefore help. So all in all, I would like to say that we must be aware that gastrointestinal and liver problems are both very common in COVID-19 patients, and we must have a low threshold for suspicion of this infection in appropriate patients. We have to live with it, we have to deal with it, and I think we are learning as we go on, because what we used to do has changed. What we will do probably which also undergo certain change. What are we really waiting for? Well, like everyone else in the world, we are waiting for the appropriate vaccine, which can certainly prevent the disease, protect ourselves. But till then, I think the basic rule applies to everyone. Protect yourself with your mask when you go to public places, with physical distancing. And I don't call it social distancing, because socially we are all connected. We are connected with the telephone, with WhatsApp messages, internet, etc. But physically we have to be separate. Even when we are getting together, we have to keep the distance. And most important, I think, particularly from gastroenterologist's point of view, is the hand hygiene. And there are very clear methods of how to clean your hands. And you require at least 20 to 30 seconds for that, which will all be promoted, and it has been disseminated widely by the World Health Organization. And whenever I have a webinar or whatever talk I'm giving, I keep repeating that because people need to know about it. Thank you very much for your patient listening, and I would like to thank everyone for this. Thanks.
Insights from the world's best medical minds. You are watching TheRightDoctors.com.